When you're pregnant, managing your health and your baby's health is so important. Luckily, you don't have to do it alone. A team of medical professionals is there to help you and your baby get the best health care possible. When you find out you're pregnant, you need to schedule a prenatal visit with your primary care provider or an obstetrician, also called an OB/GYN. For some people, your primary care provider may be trained to also provide OB care. This is the main healthcare provider you see each year for wellness checks. You also see them when you are sick or have an injury. If you have a primary care physician who is also trained to provide OB care, they can perform your prenatal checkups and are also qualified to deliver your baby. Some people don't have a primary care provider that's trained to provide OB care, but it's still important to tell your primary care provider about your pregnancy. If they do not provide pregnancy care in their office, they'll connect you with someone to schedule your first prenatal visit. At your first visit, your prenatal care provider will determine your due date and check your medical history to see if there are any risk factors for you and your baby. If they believe you or your baby may have conditions placing you at a higher level of risk during pregnancy, they might connect you with a medical specialist. They'll also give you a physical exam to determine your health at the start of your pregnancy. Your OB/GYN is also the doctor who will monitor your overall health during pregnancy and deliver your baby, but it may not be the medical professional you see the most often. Usually, OB/GYNs work with APRNs or nurse practitioners. APRNs are capable of doing a lot of what your OB/GYN does. They're able to perform prenatal checkups and answer your questions. It's normal to see APRNs during prenatal checkups, and you may even see more than one during your pregnancy. OB/GYNs are usually very busy, and APRNs help them manage their workload. Don't feel weird if your OB/GYN isn't always at your appointments. Even if you see APRNs regularly, remember they will not be the ones to deliver your baby or help with serious medical conditions should they happen during your pregnancy. If an APRN thinks a health problem could put you or your baby at risk, they'll tell your OB/GYN. Doulas and community health workers, or CHWs, are two other healthcare professionals you may want to see during pregnancy. Doulas don't deliver babies, but are there to give you emotional, physical, and educational support during the later part of your pregnancy and during birth. One advantage of having a doula is time. When you see your OB/GYN or APRN, you may not have a lot of time to ask many questions. Your doula can answer questions and tell you whether or not you should see a doctor if you're concerned about something. They can also help you come up with a birth plan and make sure your OB/GYN is aware of it. CHWs can offer similar support, but unlike doulas, they may be with you throughout your entire pregnancy and postpartum care. CHWs can also help you connect with medical professionals based on your healthcare needs. For example, if you need help finding an OB/GYN, a CHW can help you connect with one. If you need a translator for prenatal visits, CHWs can help with that too. A CHW is usually someone who's a member of your community and familiar with your culture, so they may have a better idea of your healthcare needs based on your primary language and cultural preferences. Both doulas and CHWs are available for home visits. And finally, you may want to find a prenatal care group in your area. Prenatal care groups are usually led by APRNs. They allow you to meet other women at similar stages of pregnancy and talk about questions or concerns you have. Prenatal care groups are helpful because they give you extra time with an APRN and let you connect with other women you can relate to. It's normal to feel overwhelmed during your pregnancy, but don't forget you have a team of medical professionals to help you. Visit our website for more information.